Welcome to episode number 21 of Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. I am honored that you have taken time out of your busy schedule to join us today. I am also honored that Yesenia Banks is joining us today to discuss consolidated billing, a topic that often confuses wound and ulcer management stakeholders. In fact, many stakeholders have learned about consolidated billing the hard way, either when their claims are denied or when their Medicare administrative contractor recoups payments that they've already made. So, without further ado, let's listen to Yesenia simplify consolidated billing for us. Welcome, Yesenia.
Kathy, thank you so much for having me. And yes, consolidated billing is often a topic that we hear about when one of our providers is getting a denial. So today I would like to break down what consolidated billing is, just some key details, and help you with some resources that will make sure you understand what is part of consolidated billing and know where to find that information. So we're going to discuss consolidated billing. I'm often asked by wound care providers when they get a denial, so I'd like to take a deep dive today. So first, let's start with what is consolidated billing? Well, consolidated billing is a Medicare payment rule that requires one provider, and we're going to talk about home health agencies and skilled nursing facilities today, to be financially responsible and to bill Medicare for most services a beneficiary receives during a defined episode of care. This policy was established by the Balanced Budget Act of 1997 and is implemented through the Medicare prospective payment systems. The goal of consolidated billing is to prevent duplicate billing, improve care coordination, and clearly assign a payment responsibility to one entity. Now, there are some exclusions. We're going to talk about those exclusions today, but it's very important to understand this, to make sure your staff understands what consolidated billing is and know where to find the information. So let's start with, before we get started, we're going to dive into the home health and skilled nursing facility payment models. CMS changed the payment models for home health agencies and skilled nursing facilities for some underlying policy reasons. Even though the models apply to different settings, the concept is very much the same. In short, CMS wanted to remove incentives to overprovide therapy, pay more accurately for patient needs, and strengthen the program integrity and control Medicare spending growth. The home health payment model is called the patient-driven grouping model, and it became effective January 1st, 2020. You remember that year very well, we all do, when our whole world changed. Well, it also changed for the home health agencies because they adopted a new payment model. The skilled nursing facility payment model is called the patient-driven payment model, and that became effective October 1st, 2019. Before PDGM and PDPM became effective, both home health agencies and SNF payment systems were rewarded for volume, especially therapy volume, rather than patient complexities or clinical needs. CMS and Congress concluded that this misaligned incentives and contributed to rising costs without clear evidence of better outcomes. So, within those payment models are the consolidated billing rules. Under the PDGM payment model, the home health payment model, home health agencies are reimbursed for an episode, and that episode is paid on a monthly basis. And within that episode, they're responsible for core clinical services, routine and non-routine supplies, and services provided directly under arrangement. Services such as dressing changes, non-surgical debridements, non-routine wound supplies are bundled under the home health consolidated billing episode. However, physician-provided wound care is not bundled under the home health consolidated billing. It is critically important for wound care providers to check whether a patient is under a Medicare home health episode because home health consolidated billing directly determines who is legally allowed to bill Medicare and who is financially responsible for wound-related services and supplies. I want to state this, that the consolidated billing rules are for traditional Medicare patients. It is important to verify separate rules, separate payment arrangements, and responsibilities for all of the other insurances. Today, we're focused on traditional Medicare and the consolidated billing rules that are found within the cms.gov website. Failing to check can lead to automatic claim denials, lost revenue, compliance risk, and payment disputes. And that's the last thing any of us want to deal with. So one thing I want to point out is there's a couple of things to keep in mind if your patient would clinically benefit from negative pressure wound therapy. Disposable negative pressure wound therapy is included in the Home Health Consolidated Billing Rule, but through the Better Wound Care at Home Act, home health agencies can bill above and beyond that episodic claim and get separate reimbursement. However, they are the only ones that can bill for disposable negative pressure wound therapy when a patient is under a home health episode, within a home health episode. Now, if a patient clinically benefits from DME negative pressure wound therapy, that is not part of the consolidated billing because CMS has deliberately classified this as a separately payable durable medical equipment benefit and not a routine home health supplier service. So what that means is that if a patient would benefit from DME negative pressure wound therapy, the prescriber can write an order for DME and PWT, and the DME supplier is able to fill and bill the insurance company directly, and that is not then a financial responsibility for the home health agency. So let's now shift gears and talk about skilled nursing facility and their consolidated billing rules. So like home health consolidated billing, skilled nursing facilities have 4 consolidated billing related files. Under the home health episode, you'll see 1 consolidated billing list. For skilled nursing facilities, there are 4 separate files, and it's important to know what each one represents. When a patient is under a Medicare Part A SNF stay, the PDPM, the patient-driven payment model, covers wound dressing changes, DME and PWT pumps and supplies. So in this instance, unlike home health agents, unlike the home health episode, if a patient is under a Medicare Part A SNF stay, DME negative pressure wound therapy is the responsibility of the skilled nursing facility. So DME suppliers bill the skilled nursing facility directly for the device and any associated supplies. Physician services such as active wound management services are separately payable under Medicare Part B. Again, it is important to verify what can be billed directly to Medicare Part B. It is crucial to verify the patient's eligibility or episode status before billing any wound care services. As mentioned before, failure to check can lead to automatic claim denials, lost revenue, compliance risk, and payment disputes. And what we often will hear is that a provider, such as a provider-based department, will be paid initially for the service, but then the clawback, they'll get the money pulled away from them later as Medicare processes all of their claims. So, in summary, I hope you found this podcast helpful. There are resources that we have provided to you as you confirm what services are separately payable. There's a resource link that will show you where to find the Home Health Consolidated Billing List, a link that will show you where to find the SNF Consolidated Billing List. And it's important to remember that the SNF Consolidated Billing List contains 4 separate files. Each file provides a description of the codes that are listed within the file. So for example, file number 1 states that when a patient is under Medicare Part A stay, That file number 1, contains a list of CPT codes that are not subject to the consolidated billing rule. File number 2 applies to patients that are under the Medicare Part A stay, and that file number 2, contains a list of professional component services to be submitted with a 26 modifier. These codes are also not subject to consolidated billing rules. File number 3 is specific for ambulance services that have been provided, and those services are not subject to the consolidated billing rule. And last, file number 4 is for patients that are under a Medicare Part B stay, a non-SNF stay. These codes listed are subject to the SNF consolidated billing rule and must be billed directly to the skilled nursing facility. I hope you found this helpful. Thank you very much for your time, and please reach out if you have any additional questions. Thank you.
Well, Yesenia, thank you for providing our listeners with that succinct overview of home health agency and skilled nursing facility consolidated billing. Thank you also for reviewing the links to those very important websites and for providing them on a handout that our loyal listeners can use when they need them. Once again, I also thank our loyal listeners. Without you, reimbursement readiness would have no meaning. Please keep sending me any topics that you would like the team to cover and or questions that you would like us to answer. My email address is on the screen, and it is KathleenDSchaum@gmail.com. Now, we also hope that you will evaluate this presentation and this episode. We're very, very interested in your feedback. And those of you who are watching can click on the QR code and do a very quick evaluation. And we certainly appreciate it. That's how we get our episodes to be better and better. And now, please watch for episode number 22, which will be released in about 2 weeks. Until then, keep doing the right thing for your patients and for your business. Talk to you soon.